We're delighted to have Abner with us today. Abner Gonsalves is a partner relations manager at eCareers. He's going to tell us more about what they do. He works closely with healthcare associations in a wide variety of industries to track and lead talent scoring through Salesforce and HubSpot. Abner's career includes many roles with associations and other for-profit groups, ranging from Valley Total Fitness to Schneider Electric, many associations including the American Academy of Physicians Assistants, the American Institute of Architects, and AWAN, which is Obstetric and Neonatal Nurses, right? So he knows a lot of nurses and a lot of healthcare practitioners, so he's well qualified to make the transition to the other side. His specialties include strategic planning, web analytics, SEO and SEM, and maybe he'll explain what those are for those who don't know what that is. He's going to talk to us more about the opportunities he sees and from where he sits in working with a wide variety of healthcare associations on what's changing in that career world today. So please join me in welcoming Abner.
Thank you. Ken communicated tremendously, and I just marked it. I think I might have been in Denver when you sent that meeting request. So I was sitting having a nice, comfortable cup of coffee, relaxing. I was going to get here when I got here. I was going to be early. So I apologize. First, don't do that. Don't make that mistake. So has anyone in the room been in healthcare, currently in healthcare? What type of roles?
Health and lifestyle coach.
Health and lifestyle coach? Researcher? Researcher.
I'm a healthcare editor, and I have additional credentials in electronic health records. Excellent. And healthcare IT.
Oh, EHR. Excellent.
Researcher and pharmacovigilance.
I'm sorry?
Researcher?
Researcher.
And pharmacovigilance.
And researcher.
Hospital and medical practice management.
Excellent, excellent. So the reason why I wanted to clarify that, Healthy Careers, we're the largest physician surgeon job board in the country. No one knows who we are though. You go to the American College of Cardiology, you see the job board, it's us, not the American College of Cardiology. It's the example I like to use. I'm going to give you kind of, healthcare is crazy. Healthcare now is the largest employer in the country. Research is a little different, and because usually it's done through the university program, you got to be good at writing grants to kind of get a job. You kind of have to create your own job. Healthcare now has surpassed all other industries, being the #1 employer in this country. It's only going to grow. You kind of hit on the gig economy. Healthcare, I would say, is about 10 years behind, well, probably 50 years behind every other industry. Good example, when's the last time you went to a bank and saw a teller? Rare. You can open up an app right now and you can tell me the last thing you purchased, the meter machine that didn't work for me and why I couldn't find my card. You can see all those interactions. Ask somebody what their blood pressure is and they have no clue. And they can't get it. That's going to change. CVS has become a big player, Walmart, Walgreens. They're becoming providers and also consumer-focused healthcare deliverable systems. So an example I used a couple years ago, Uber, during flu season, allowed you to get an NP would actually be in the back seat when you got in the car. And they would give you a flu shot. And everyone's like, oh, that is so smart marketing. That was a business plan. That was a test. And now, I don't know if anyone's paid attention, Uber just announced that they're going to be doing medical rides for people that can't get to, and Medicare, Medicaid will probably cover those rides. I won't be surprised if CVS, some other insurer buys Uber, because you're on your way, you have to go see a doctor, your prescription's running low, you get in the car, CVS has already supplied that prescription, it's in the car for you, you ride, you get the prescription from the doc, on your way home, they've already got you covered. Convenience in healthcare, what other industry do you go and sit for an hour and wait to see something?
Yeah. For 5 minutes.
You just walk out. So the beginning of this presentation is pretty cut and dry stuff on resume, real quick, I'll fly through it, and then I'll get into some of the nitty-gritty things that I go to a lot of association meetings. Most of the time I'm talking to physicians, neurosurgeons. The issue with them is that they've got to decide which $1 million job they want. That's so difficult to be one of them. They did go to school for 10 years and racked up $1 million worth of school debt, but so really quickly, for yourself to think, what are some of your goals, your challenges, and successes? I think a lot of us always think of, we don't want to think of ourselves as failures, but we don't like to promote our successes. And a lot of that in your resume, your CV, you want to make sure that you're promoting the best you. It's kind of like the dating, when you're going through the first couple months of dating. It's not the marriage, it's the actual you're putting your best foot forward. And I think a lot of us, I did do that. I did. As soon as I go home, I'm adding this 40 plus meeting in my resume. It's going to be on LinkedIn. You got to always remember to add your successes, the things you do, because sometimes we forget who we are and that we're actually succeeding. So just make a mental note. Goals, challenges is the thing that we can always think of. It's the thing we always think of. The successes is what I would like to see you focus on, because I think we just don't do it enough. So trends, we kind of hit on this, on what's going on in healthcare. Number of 19 million. The unemployment average in healthcare is 3.3%. And then the average time it takes to find someone in healthcare is 51.4 days. That kind of gets leveled out when you're looking for an ear, nose, and throat doctor, and it takes you, or otolaryngologist, which takes you about 2 years to find, a urologist about 2 years to find. Other than that, nurses and things like that, they'll be sitting in a room like you are right now and get 3 or 4 offers within an hour via email and text message. So if you have some background in healthcare and you're kind of thinking about maybe going in there and finishing a nursing degree, might be a good idea. But that is a little bit different. The other thing that's hard on us, because we're all here in the DC metro area, I love living here. I don't know about you all. A lot of people want to live here too. So that makes your job search a little bit more difficult, because if we're all in Idaho, where it's like a 1.2% unemployment rate, and I'll pay off your school loans. I'll do anything I can to get you to come to Idaho. DC, they don't, pay the next guy less than you because it's DC. So, number one thing, this is a little pitch for Health eCareers. Online job boards is everyone's favorite place to go. But if you're not in healthcare, if you know of an association that is in your background, you've been, whatever your specialty, I'm a marketer, so certified, the American Marketing Association. How I met Ken is through our association called the American Society of Association Executive for people like me and him who are CAEs, which is this weird thing. There's an association for association. But they have a job board. So you utilize those. The reason why those jobs are a little bit better, people are spending dollar to find a specific type of person. And you may be that type of person. So use your associations. Sadly, I was at the American Institute of Architects in 2008. I don't know if anyone can recall, there was a little problem with our economy at that time, just a small one. And actually, what I found interesting is instead of people leaving the association because they were losing their job, they actually churned to it. Our membership went up. We gave away a lot of free memberships that year. But the membership went up because people churned to their association for support and help. It's a great tool and resource, great networking opportunity. Your resume. Okay, so this is the nice fluffy part. Later we're going to come back, we're going to do some hard-hitting things. You've probably heard them before, but so first, use a simple, widely available font style such as Arial, Calibri, or Garamond. Be no more smaller than a 10-point font. Use bullets, create easy to scan. Okay, you guys have seen this one 100 times. Don't waste the first quarter of your page with your address, an email address. I think the mistake a lot of people make, and I especially see this with healthcare professionals, because they're so focused on, the school they went to and all the great things they've done in their careers, leading up to their careers. You're not writing for the person who does your job, or the person that's going to hire you. That's not who your resume is for. Your resume is for the person who's going to scan it and give it to someone else, because you are going to make them look good and yourself look good. Do not write it for the hiring manager, hire it for the recruiter, or the person, the executive assistant to the recruiter. If it takes me 3 pages to figure out what your specialty is, what you're good at, what you know, I'm going to somebody else. And more than likely, they're scanning on a computer or maybe a laptop, or I don't think anyone's looking at resumes on a mobile device, because I don't think anybody loves their job much. But make an HR person, a recruiter's job easy. Okay? Don't make their life difficult. And we'll get more into that when we kind of just wing it at the end. Name a phone number. We're going to put that on, of course. Don't forget your credentials. Someone mentioned EHR. That is probably the #1 piece of advice, which is an electronic health record. That's probably the #1 piece of advice I give to physicians, because they put, what they've done and what they've practiced and when they went to school and things like that. But if I'm in Kaiser Permanente health system and you're in a different health system and I have a different electronic health record, you might be the greatest doctor in the world, but if I got to teach you how to use the EHR, I'll get somebody else that knows the EHR. So I always tell them, list your EHRs that you know. Same thing with you. Any type of computer program, any type of tool, make it clear, right? Because it might say, if it says in the job description, you need to know this, this, and this, you better make it really easy and clear on your CV or your resume. I know these 3 things that you would ask for. That's the most customization I recommend. If you have the skill set, no one asks for Microsoft Word. You should know it. But if there's if you're an accountant, if you're doing some type of business and it's calling out for a specific type of software or skill set that you need to know, you need to have, make sure it's easy for that person to see it. Don't bury it 3 pages down on a listing of a bunch of Microsoft Word, Microsoft Excel, blah, 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 blah. Pull out the special important ones. Make it very clear. Highlight successes using quantifiable data. Give me numbers. I was very successful. At what, how, when. Give me a time frame. Give me specifics. So for instance, I'll use an example. I'm a marketing person, so I send a lot of emails. Email communications, delivered email communications is a bullet I could put. Or I could say I delivered anywhere from 3 to 5 emails to an email list of 1,500 people once a week, and they had an open rate of 30% with a click-through of 14% on average for over 2 years. That's a better bullet. Now I've got a scope of what this guy can handle. If I send emails, 1, 2, 3, 2,000, 2 million, make it quantifiable so they get an idea of your scope. I'm a self-starter and a team player. Next slide. Like, don't do that. If you have an objective in your resume, consider if you even need it. Is it going to, for that recruiter, again, if you're trying to look good to, actually not even the recruiter, the recruiter's assistant that's going to hand it to the recruiter. So I'm going to take this sheet, I'm going to take your CV if I actually did print it or email it. Hey boss, I personally am putting my name on the line for this person because I think they are qualified. That's who you're writing your CV for, or your resume, not for the person hired. So if they can't do it quick, in the 10-minute scan, the way that you review a website real quick, you're going to read it, you kind of read top and then down the side, and then decide if you're going to read it. That's what they're doing in your CV. So customize your skills section. Don't rewrite the CV or resume every time you do it. I've been dealing with docs so long, I can't help but not say CV and resume. I'm sorry. But experience and descriptions, that's if, I kind of debate that. What you are is what you are. If you write strong bullets, you don't have to customize that. But if they're saying, we want Epic, or we want this, Epic is an EHR, or they want to make sure they have Adobe abilities with Adobe, make sure you highlight those, change the resume, make sure that's a skill set that's really high. Your career summary, your career summary, how are you going to customize that? It is what it is, your career summary. But this one, read the job posting. If there's words, keywords, specific things that they're looking for, you mentioned SEO, search engine optimization. That's being able to gain Google. So I make sure that your stuff shows up. I do all the little funny, weird things with subject lines and how you title a blog or a blog post. Editors hate the marketing guy because I'm always trying to change. This is what Google says works. So use those key job postings. If they don't mention those strong ones and they mention other things that are in your skill set, move those up. Okay? Again, for the scans, you want it in a place that they can see quick. 15 seconds at the most they're spending on your resume. Job opportunities. Do you know where to find them? Obviously, I'm gonna say job boards, Association of Career Centers. That's what I'm gonna say. That's what we do. But it's very true. The reason why a Glassdoor and Indeed, they're called what we call aggregators, and they kind of just scan the internet and they pull jobs in. They could be really garbage, old, been around for a long time. They're not specific. An association career center, that's someone that is, they're extremely dedicated to that profession, and they want to spend the money looking for the right person. So you're going to get that from the association. Obviously, you're going to look at Indeed, you're going to look at Indeed, LinkedIn and Indeed, but go to your associations. The other thing too, get a clean date. Once your resume is at a point where you think it's good, and you've got it, had it reviewed by other folks, and great opportunities and events like this, upload it, put it into the resume database. A lot of times before they spend the money, so they a lot of recruiters pay for access. Part of their package to post jobs is they get access to the resume database as part of it. And what they'll do before they post jobs, they'll search resumes. So they have this thing between passive and aggressive seekers. So an aggressive seeker is probably somebody that's currently out of work, clicking on every, or hates their current job and clicks on every job that they see. That's an aggressive seeker. For whatever, which is I believe in recruiting is one of the dumbest philosophies in the world. Because you're an aggressive person is desperate, will take any job. And a passive person, they're picky. This is the change between a passive and right now I'm a passive seeker. I love my job, I love what I do, I love working travel careers. I travel a lot. I actually found out I'm going to Denver and I got to tell my wife. Again. I walk home today and I was like, hey babe, I got to go to Denver. She doesn't take it well. I am now an aggressive seeker. That's how quick it happens. So passive and aggressive I don't believe is a good term. The thing you do is you end up losing a lot of people who are passive when it's a long. So if I'm happy what I'm doing, and I submit my resume and I know you all done this. You submit your resume, and then I ask you for another 20 minutes to tell you everything that was on your resume. A passive seeker is going to say, not worth it. Are we any different? No. We're just our circumstances are just like different. Passive aggressive seeker, good person, just circumstances can change anytime. But upload that resume because they will search for you. Let's see, include resources on industry events, other networking opportunities, stuff like this. Associations have tons of stuff like this. Resources, tools, meetings, networking. Networking is probably your best bet at finding. Bless you. Networking is where you're going to meet that person who may get into a new role. I've been waiting for people I've known for a long time to move to an association I like, and so I can come with them because we network, we're good buddies. But you never know. So that's where you're really going to have. But the associations give you the opportunity. And there's one. My favorite one is the Explosive Engineers Association. There's another NRA, but it's Naked Recreational Activities. That's the other NRA. A little bit different. So start by posting an updated resume so recruiters can find you. Set up job alerts. So one of the things that a job alert sends you, you say, I want to live in this area. I'm willing to travel within 15 miles. I'm looking for jobs in this role. And then and you'll see it. There's a button on almost every job board. Set up job alerts, and it'll only email you with jobs that fit your description pop up. Okay, so you're not just getting a long list. I used to work for the AWON, which is the Association of Women's Health Obstetrics and Neonatal Nursing. A lot of our hospitals would get upset because they would call them and say, hey, I'm getting these bad job applicants. So what's the problem? It's like, delivery. We're getting truck drivers. Because they would get keyword search delivery. Labor and delivery. A little bit type of.
So Abner, let's turn that around.
Yeah.
Regarding what do you think about how specific you should be? Because especially if you're making a shift, perhaps from one world to another. I mean, we want to be flexible. I think many of us are actively looking, as you mentioned, and so we're motivated.
Yeah.
But if we're not, my sense is if we're not specific enough, then You know, we're not good enough. We'll take anything. We appear to be willing to take anything as opposed to focusing on. What's your thought? What do you think?
So medical admin is, one, you're wasting your time. So medical admin level positions get posted on Indeed a lot. And we used to be in that space as well. And we used to get, so you have a physician, it take you 6 months to get 3 applicants. Those are very specific, 3 applicants looking, you know, a neurosurgeon in New York. Very difficult to get. Medical admin, we get 500 applications because it's just quick. You're just applying into the, and it frustrates you. So I'm not hearing anything back. I'm just, well, you're one of 500. So why waste your time in a job that you have no inclination? You did mention earlier about the gig economy. The beautiful thing about the gig economy is it offers you an opportunity to get out there and kind of vibe onto a position and see if it works for you. We actually, at Healthy Careers, we developed a product called Shift, which was intended for medical professionals to kind of work when they wanted to. And there's a phrase I hate it, I'm gonna say it, I hate it, millennials. I hate that phrase, I hate it, because it's the same way of lumping all baby boomers the same way as the same lumping millennials. But we developed this product for millennials. And I went to association meetings, and I didn't speak to a single millennial about it. I spoke to nothing but baby boomers. I'm retiring, I want to spend half my time here with the grandbabies. I want to be able to do what I want to do. These are baby boomer doctors. We're into the gig economy. There's no benefits. There's downsides to it. But it's where, like you stated, one of them's growing, one of them is not. It's going that way. Be open to it. Make sure you put away your taxes, your 1099 when you're working on a lot of these gig economies. You can get hit at the end of the year. But that, I think that gives you an opportunity, if you're thinking broad scope, and there's places you might want to work, try it out with a gig opportunity.
Excuse me.
Yeah.
Can you just only gig? Is that acronym?
Yes, no, it's like I picked up a gig, like Uber driving or delivery driving. You kind of you're not really doing it. It's just the funny thing is, our unemployment rate in the U.S. would be a lot higher if it wasn't for the gig.
Okay.
So it's an opportunity. It's the way the economy's going, especially with retail getting crushed. Don't be afraid of it. Is it great? But it might, maybe not. Maybe you might end up finding something that works really well and it ends up being great. But there's a website called Fiverr, depending on your skill set, some Fiverr. Obviously everyone knows Uber and Lyft. CVS and Walmart and Walgreens, they're all going to get more involved in the gig economy as they expand into healthcare. Almost everybody else. Amazon, all those guys. And then follow application instructions to the letter. So people get a really easy, Indeed, easy apply, LinkedIn apply, easy apply. I love those. Boom. But if you read the job description, all the way to the very bottom, email careers at, and you just took yourself out of the race. Because it's almost like there's that old joke. Answer the first 15 questions of this test, but there's 100 questions to the test, and the kid at the end was like, I answered all 100. It was like, hey, but you didn't read the instructions, you only had to answer 15.
Yeah.
That's kind of what they're doing. They're kind of weeding out the people that are just an aggressive seeker. That's so clicking on everything. So follow all the way to the, and then also look by date, not by relevance, because if you do relevance, it'll pull up something that's been on for 6 months and someone just forgot to take off. So interview prep. 1, be on time. A firm handshake, warm smile, these are all the things you know. Open, relaxed arms. I'm from New England. This controlled hand gestures. I grew up with a lot of Italians. It's just not gonna happen. Feet on the ground, crossed ankles. I don't like crossed ankles when you're sitting. It puts you in a weird position when you're seated. I don't know why. And then avoidance of fidgeting, again, that's not happening. But also good eye contact. Very important to make good eye contact. Don't stare at someone like you're going to take them home and like make them the next, and murder them. But just make eye contact. Tough questions you're always going to get. Again, tell me about your, oh, that was supposed to be just a regular job. Tell me a little bit about yourself. What is your greatest weakness? Do not tell the person you want their job. Like if you're interviewing someone, like I want to be where you are. Why should I hire you? That's a tough one. And these are all personal answers. And the thing that I think, we kind of joke to ourselves, and actually right before I came, I was reading an article from Harvard Business Review. It was a Harvard study where meditation actually changes your DNA. And humans are afraid, like we've kind of like, don't talk to yourself. Talk to yourself, practice these questions. Run them through your mind in front of a mirror, how you deliver them, what you're pointing on. These are all very personal, so I can't give you answers to them. Yes, question?
I have a question about your phone area code. Does it matter? Like, when I moved here to DC, I kept my same California area code. So I still have a San Francisco area code, and part of the reason I have that, well, two. One, I have a really easy phone number to remember, and two, so that when people call me, people see, oh, it's Giovanni because it's this number. And so it's the same number I've had now for, a very long time. But I also wonder if people see that and go, oh, this guy is calling from California. He doesn't live here. He's self-selecting. If we should have a 202 or 401, or are we at a point now where people are so cell savvy, people have so many phones that
it doesn't really matter.
It doesn't matter at this point.
Yeah, before you were tied to you're from this area and they had AT&T, so you were tied to that number. If my mom and dad didn't have their number the same number since I was a kid, I would not remember it. My dad's cell phone number, I have no clue what it is.
Right.
He's dad. On my phone. It's like that. So it doesn't really matter, and people have moved their especially when they broke the rule where you can take your cell phone number with you. People kind of use it as a badge. Actually, it might even help you. It's like, I'm from California, he's from California. It gives you that point of connection with someone that you wouldn't usually have. So I don't think it's a bad thing at all. I will get into so that's more of the fun stuff we're going to get to once I get past all this dry stuff. Prove you research the opportunity. Know the audience, know the company, know the background, know what they're trading at, if they're a public company. Don't walk in blind. I remember probably about 10 years ago I had a big interview and I was excited about it, and I Googled the lady I was meeting with. And I told her all this stuff about her. And she was like, you Googled me? She looked at me kind of weird, like I was a stalker. And now I'm offended, like, you didn't Google me? You don't know what I'm into? Literally, know everything about everything. Know what their interests are. If I find out that your favorite soccer team is Arsenal, you best believe I'm coming with Arsenal socks and crossing my leg and see that. Oh, you're from Green Bay and you like the Packers. I'm going to let you know that I know about you. Because we're all out there, LinkedIn, Twitter, whatever. Don't be afraid to do, I know obviously don't walk in the Packers watching you. But just make sure that you've done your understanding of them and the industry. You're not looking for just any job. This is what I want for my career. I have a vision. Because your vision is like my vision. We're going in the same place. It was like, I just kind of applied. Yeah. It was easy apply. I hit it. Make sure that show you that you want to succeed. All right, so follow up, be mailed within 24 hours of your interview, be customized. Make sure you put the person's name there, not to whom they're concerned. Something you spoke about, man, do I love the Packers. Aaron Rodgers is awesome. I hate Aaron Rodgers. But anyway, if you just have to follow what happened in that meeting, be genuine, okay? Respond promptly to any phone calls or emails. That person, so they liked you. You met with them, got everything going. Hey, call this person back. And then you take 2 days to get back to them? Did you just make that person's life easy? No. If you don't get the job, don't give up. Connect with them on social media. Share with them interesting stuff in their industry. Make them look at you as you're a thought leader or you have some experience and you're if I met with you and I knew everything about you that day and about your job, and then 6 months, or your company, in 6 months I walk away and I don't, they might have considered, you know, that guy was nice. Well, that lady was nice and I want to bring her back. And they notice you haven't mentioned anything about that in your social media, LinkedIn posts, anything. But if you share stuff on that content, that was a job you really liked, or you email them like, hey, I've read this article on this topic, I think you might like, show that you're in that industry and you care. Okay. So here's the fun part. Does anyone in this room have an AOL or Yahoo email address? Get a Gmail. Use the Gmail.
Is Hotmail valid? I know it dates you, but
You kind of hit it. So a lot of people think when it comes to ageism that they do it's because of my age. It's because they don't think that you are technically savvy. And if you have an AOL, Yahoo, or Hotmail account, sometimes they immediately, I mean, AOL and Yahoo are almost out of business. Or they're out of business.
Yeah, for Gmail, I talked to some folks that are experts in the IT space, and they said part of the reason it dates you, but part of the reason is Gmail is a better platform in terms of security, and if you're not using it,
except that they've been hacked. Other than that,
Yeah,
they're all everywhere.
I'm not saying they haven't been hacked. I'm saying they explained to me that every platform, every email account has their strengths and weaknesses, but Gmail is considered the strongest, and so if you're basically, people think if you're not using it, you're not aware of that.
You're not aware of
And
it.
they wonder, what else aren't you aware of?
Don't use
So
your
that's the
personal
question.
company email address either. Don't do that. Don't use the company you're working for email address. I see that a lot. So that's good. We don't have a lot of people on AOL or Yahoo. What's the other one I was going to say? You kind of mentioned about phone number, where you are. One of the things I see a lot of people do is they don't want to get personal. We live in a very different society than we did a couple of years ago. Everyone shares what they eat for breakfast. If they eat what they eat for breakfast isn't moving as good as they would like, they share everything. When they look at your CV or your resume, don't be afraid to highlight the things you do. There was a Harvard Business Review study on resumes. It was pretty telling. It got a lot of press. Freakonomics did a study on, or did a story on it. But they took the same CV or resume and they changed the name. Everybody's seen that story, right? Yeah. And then John Smith got picked a lot more than Jerome Brown. We all seen that. The next step in that research, to me, was more telling, because they kept the name the same, they kept the resume the same, but they changed qualifiers. So I'm first generation American. I grew up in a working class town. I played the sports that were free at the recreation center. I played basketball, soccer, and football. And those were my sports because that's what I had access to. So that, on one resume, was your teller. Crew, I rode crew, I played tennis, and I golfed. That was a different teller. And that person that had those tellers got picked more than the person who didn't.
That's interesting.
So, interesting thing, my daughter picked up lacrosse. I'm a volunteer on a lacrosse coaching program. Guess what's on my LinkedIn profile and my resume? Lacrosse, because it's a teller. You hate to say that, but how many times have you seen, oh, I went to that school? I have a friend who went to a very prestigious Ivy League, said that's the best network. He doesn't do anything. He was just like, oh, yeah, you come. We'll give you a job. We'll send you to England. You do what you want. Like, we got you covered. It's a great, so you've got to give people opportunities to connect with you. If it's your school, it's your activities, like snowboarding, skiing, rock climbing. Don't be afraid to put that into your CV or your resume or your LinkedIn profile. So, LinkedIn. Oh, go ahead.
I have a question. I belong to associations where a lot of freelancers post, we have the opportunity to post our resumes online. And because they're online, people leave off their street address, so it just does something like Joe Smith, Rockland, Maryland, 208.
That's smart.
And then the phone number. Is it okay to leave off your street address?
That's smart because it's there and you don't want people to have access to your data.
Then what if it's the next step where you're sending in a job application directly to a company like, let's say you're applying for a job at GW, should you, for a resume that's directly submitted, should you put it back on and say 123 Maple Street?
So if I'm gonna hire you, you're exactly what street you live in.
Well, does it look sloppy to have or does it look lazy or something to have your
So-
street address left off?
I'll tell you some things that will make you look better and will make you look worse. Not having your address there, as long as they have a phone number and an email, they're not sending you direct mail. No, right?
But in terms of formatting, does it look lazy or does it look like
No,
a typo?
no. It actually, so if when you work in editorial, so you know sometimes you got page counts.
Yeah.
And you got to strike the least important content.
Yeah.
Your address really isn't that important.
Okay. That's why it works both ways for me. Like, if I do anything, like anything that I do is like this is better. This is the thing. It like it's super sweet.
Yeah, it's very important.
And
So it's important. It's good to know, but I don't think that's not what's going to keep you,
okay.
or keep you from a role. What will keep you from a role, and I personally believe it. I've heard from recruiters they don't really care, but you got two applicants. You have one that includes their references, and one that doesn't. Contact for references. You already gave me your references. I'm trying to make myself look good. I don't want to spend 3 days chasing somebody to get references.
The next thing, I have a question about that because I dealt with a recruiter or a placement agency. They were not the most professional.
Mhm.
It was a smaller
Shop.
organization, and they had these very young people that didn't have the professionalism
Mhm.
developed yet, and they were like,
Thanks for not using millennial.
yeah, it was like a 3-year-old brain in an adult body
Yeah.
who called one of my references, one of my valued reference. We have a great rapport, and he's the kind of person that's going to say glowing things. He's great. But they called him like 4 times in one morning
Oh,
because
geez.
he didn't get back to them right away. And I'm like, check your narcissism at the door. I know that you want to place me because you make a profit, but if you take off one of my references, that's it. He's never going to talk to anybody.
So if you're working with a recruiter, there are some different rules.
Yeah.
So recruiters, you want to control that situation. For instance, with healthcare professionals, a lot of times we tell them not to give them your contact info, just because it can turn into 5 calls in a minute. It's insane. What I would recommend when I say references, this is for when you're directly applying. So you kind of mentioned that you had 2 different, one with your address, one without. This would be the one that would be you're directly applying to a position, not to a recruiter or a recruitment firm.
But they get like hundreds of resumes, and I don't want them. I don't want like I've had this experience a few times where my references like we're happy to be a reference for you. We're so thrilled. We're going to say great things, but they've been like getting dozens of calls from people that were just tire kicking, and that's not fair to me.
So that's surprising because usually the case is that you can apply and you won't hear anything. So that's usually.
I mean, it's not fair to my references or me to be throwing out all these numbers for people when the people fielding these resumes. I mean, they're a lot of times they're just not very professional and they don't handle your information in a responsive way.
So from my experience, recruitment is a little bit different. I'm not sure of the industry and where you're applying and the types of calls you're getting. Usually that's not the case. They don't get a call. Usually they'll contact you beforehand. It's like, is it okay to contact your references? And and then you reply and you say yes. The difference is, okay, email it. Well, I'm out with my kids and I don't have access. I'll send it to you tomorrow. Or I'm traveling. Or they say yes, yeah, you can contact my references. They're in my CV. They're in my resume. That is going to help you.
So you're saying if I've been hesitant to provide when they ask because so many people are so irresponsible. But you're saying that's going to work.
It depends on the spec, but for the most case, that's not going to be an issue.
Wouldn't the bridge be to say, contact me first? Like, provide references, so they're right there, contact me first, and you'll be able to govern.
Yeah, contact me, but I've had my references on my resume for years. Maybe 5-6 times they've been contacted, but it also depends on where you're searching and what the specialty is. The other thing too with your references is really important is have someone you worked for, someone you worked with, and someone that worked for you. So those are 3 very important ones. You want to build you ever heard a 360 review? You want to build a 360 review of references so they can see you from all angles. The fourth thing is we all know someone with a really great title. It could be your neighbor, a friend, somebody you went to school with 20 years ago. Reach out to that person. Hey, this person is vice president of mergers and acquisitions at JP Morgan and Chase. You're going to be, I remember that we had that dinner party 20 years ago? Yeah, would you mind being my reference? Just for that title. I hate that, sounds horrible, but it gives you a vision of gravitas. But somebody you work for, somebody you work with, somebody work for you. And then, like you said, the title. You want that title.
When you mentioned that, what about like volunteer positions? Like if I'm in Toastmasters or
Yes.
An association, when you say work, it's not monetarily.
Volunteer work, it's actually volunteer going to that, I added lacrosse to my daughter, to my volunteer work in lacrosse. I have no clue what is going on when I go to those games. No clue. They blow the whistle. I thought that was a goal. I have no clue. It's on my resume. If you donate money, if you provide, if you volunteer things like this, you want someone to grab. So if you have two people and they're apples to apples. Oh, he's from California. Oh, he knows so and so. She knows. You want that personal connection. Oh, he knows about lacrosse. I love lacrosse. If you're a booster for the DC United and you're a member of the Screaming Eagles, this guy loves soccer. I love soccer. Don't be afraid. You want to. Again, 10, 15 years ago, don't do any of that. You're vanilla, straight up and down. Now they need to know who you are. You're part of that culture, that experience, and you are who you are, and that's valuable. The things you want to hide are stuff like the AOL account. Not because of age. A lot of people say, I've worked with a lot of nurses, and they don't want to hire people my age. No, they just want to make sure that you show that you are into technology. Highlight your strengths in technology, because that is what they're worried about, the lack of experience with technology. Take courses on technology. It's complimentary stuff all the time. Add list. If you go and you look at job descriptions that are in a field that you like, and the same computer program is there listed every time, you better have experience in it. You gotta at least know it. And then highlight that you've done training, you've submitted this. Certifications are important. Go get certifications. A lot of them are free now. Google Analytics, Google AdWords. Whatever your specialty, whichever region of the industry you're in, there are skills and tools that you need to have, and there's somebody trying to sell those skills and tools. And what they want is people certified in how to use those tools. So they will, a lot of times, will give you free education and certifications on those tools. So that, and then the other tough thing is where we are. It's going to be a hard. DC is a tough. If anyone's interested in Idaho, Iowa, great place to live. But the demand is higher for people. Here, everybody wants to live here. Not with this weather, we have. So that, any questions? Fred?
Oh yeah. A couple of things. So the professional reference you can just post the list on LinkedIn.
I was trying to remember what I was forgetting. So when your LinkedIn should look exactly like your CV or resume. They should mirror each other. They shouldn't look like two different things. But quick warning, has anybody ever congratulated somebody in a new job and then that person coming back, oh, sorry, I was just updating my LinkedIn profile. I've been here 5 years. Don't be that guy, or the guy that comes late to meetings. But anyway, make sure that you turn off notifications before you make changes on LinkedIn. Turn off the notifications for stuff that you're just updating. When you're working for someone, you definitely want to do that. You don't want them seeing that you're updating your LinkedIn profile every 5 days. But even when you want to control your external appearance. Again, network might be where that next job comes. They probably already know you. So turn off your notifications. If it's something you want everybody to know, you got a new job, let that go. But if you change your profile picture, you added a couple bullets on what you did when you worked somewhere 10 years ago, you don't want that out. So turn off your notifications, turn them back on when you want them to work. Sir?
What are your thoughts about Twitter
So,
and,
social media. So,
and saying, making comments, praising your sister's comments about her favorite this or that, or
so again, that person that's looking at your CV that first time, you've made the first 15-second scan test and they like you and they like 3 other people. They're going to Google all 4 of you. So they're going to see what's up on Google. So all of you, when you get home, or when you get someone actually not home, get on someone else's IP address. So if you do it from any device in your house, you're going to get the same return because you're on the same IP address. From a separate IP address on someone else's device, Google yourself. See what comes up. If you Google yourself on your own PC or on your own machine, it tells you what you want to see. They'll even pull into your email and say, hey, you got a trip coming up in 3 days. Like they know everything about, they know more about you than you know about you. So Google yourself from somebody else's device. What you see there will come up. I've engineered what people see when they see me. I have a Twitter account that is all fun and party and stuff I don't want people that in the professional world to know about. And I have my professional account that everybody has. You all can go find it. And even that, I go back and I see maybe I got a little carried away and I like something I shouldn't. I go back and I clear that out. Facebook, Instagram, anything like that. Make sure you'll be able to see what comes up when you Google yourself. Go and turn off your Facebook profile so it's not public. Instagram account. Either make a professional one and keep it live, or that personal one with you a couple, 1 too many's. You might want to make a decision on how much of that's seen out in public. And your commentary on politics, either way. You want to make sure that that's kind of not, you want to control that message. So Google yourself, not from your own computer and not in your own Wi-Fi address. If you know your neighbor's Wi-Fi address, go ahead and try it. But or Wi-Fi access. But yes, I call it not LinkedIn or Facebook. It's your online presence. The blogs you write. If you're very passionate about the industry or the profession that you're in, write about it. Put a blog. If you're volunteering for 40 plus or another organization, and you're doing all this free stuff for them, you know what your currency is? I want my name on your website, and if you can, I would love to write these blogs for this part of your page. So when people do, that's your currency. So somebody can see that you know what you're talking about. Your association, volunteer programs, make sure your name's on their site. Yeah, okay, I'll handle the bake fair, but my name's on the site. That's your currency. Because I'm involved. I'm not just involved as listed on my CV, on my resume. You can Google me. You can see what I'm doing. So online presence is very important. Google, it sounds narcissistic to Google yourself. Fred, you have another question?
Oh, yeah. Well, I think it's, I mentioned like putting professional references, so just post those on LinkedIn, like post like a Word document or...
No, I wouldn't post your professional references on LinkedIn because then you'll lead to the same problem she had where people are just contacting them.
Right.
You wouldn't want somebody just posting your phone number and email out there in the world. On your CV or your resume that you're submitting directly, have it on there near the end, and again, for somebody you work for, somebody you work with, somebody you work for you.
Okay.
And then someone that has a really great title. The reason why, again, that person that has 4 CVs, and I see that, I don't have to go chase this person for their references. Yeah, I'm going to call them and check to make sure I can contact them, which they would do, any reasonable person would do. But I don't have this one less step. You just made my life easier. So when I hand this off to Ken and say, hey, Ken, you're the 3 people I think we should go after, he's not going to come, hey, I don't have references for these people. I say, no, you got them. I got you at all. You have it all. Let me know. So those are some tips. It's probably your hardest thing is where you are. It's the unemployment level is unbelievably low. A lot of that is because of the gig economy, and why this area is so challenging is just everyone wants to live here. You have the highest, strongest concentration of PhDs. Everyone wants to come here. It's a good place to live. I like it. So that's probably one of the challenges. Set yourself aside on making the person who's doing the recruiting, make their life easy. Not the person that's hiring. Don't give them a 20-page cover letter. He or she is just not going to read that. They're going to scan it real quick, 15 seconds, and you either made the list or you didn't. So,
I have a quick question. A lot of the groups you work with, of course, are highly specialized.
Yes.
More on the clinical side,
Yep.
let's say, physicians' assistants, nurses, and so
Docs,
forth.
yeah.
Perhaps some of us, myself included, don't have any of that clinical background. Have you seen common or at least some transferable skills or backgrounds that might apply? You know, you think about financial, you think about contract management, communications, we've heard some people going. Are you seeing any sort of changes in demand in healthcare in those areas?
Yeah, so healthcare, because it's going everywhere, there was I think it was Advertiser, I can't remember what journal put it out, but people are no longer going to their primary physician. They're going to urgent care centers because it's easier, it's quicker, it's efficient. Again, going back to where are you going to sit for an hour to talk to a doctor or a car salesman? They're like, we'll be back in an hour. You go to the next target. So people are doing that, making that same decision in their healthcare delivery. CVS. I'm of a certain age where I would never go to CVS for healthcare. A lot of people do. I would never go to urgent care center. A lot of people do. But probably that's where I'm of a certain age, so I don't do that. But that opens up opportunities. You might not see a lot of new doctors opening up offices, but you do see a lot of people, like you did medical management. Urgent care centers are popping up. Everywhere you see a Walmart, there's an urgent care center. They need somebody to manage it. They may have a centralized location that manages 3 or 4, but it's got to be somebody local. So that's an opportunity, urgent care. So I would look at stuff that are urgent care. They probably have a blog on their site. Content is king. So what leads the world now, or how you find something, is usually you read about it, you learn about it, and then you decide about it, and then you pay money for it. And a lot of that is content driven by stuff you can find online. So if you're a writer, urgent care centers, if you highlight why it's better to go to urgent care than a primary care physician, and that shows up on the website, maybe they'll pay you as a gig economy there. I think the biggest thing to be open and also quantifiable. So if you're an accountant or if you have experience running an organization, how big was the organization? How many meetings did you have? How many staff did you manage? Because that's transferable, to an urgent care center or a CVS or something along those lines. But they need not somebody that had retail management experience. They need somebody that had professional services experience in management. So I think that's the transferable. Because it's going to, the delivery method of healthcare is going to a much more hand-to-hand, same way you go to the supermarket, buy a candy bar, you go to a supermarket. One of the things that I think we're going to see is with diabetes educators, no longer will be in office, but you walk in the Safeway, hey, I have diabetes, or probably your phone will give you a little, and the diabetes educator will walk you through and stay out of that aisle, buy this, buy that, buy that. So healthcare is just changing. There's going to be different skills. And then if you're, like you said, transferring skills in the gig economy, I have this skill set, maybe I volunteer and come in and work and just provide, hey, and then you add that to your resume. And then so if I volunteer, what's the monetary exchange? Get your name on the website. Don't just do it. And don't just put it on your website, don't put it on your LinkedIn profile. Well, you should do that. Put it on your LinkedIn profile, put it in your CV, put it in your resume. Ask them, hey, is there a place you can put me, just list me as a volunteer on this project. Because when someone Googles you, which they will, that'll come up.
What about medical billing, medical coding? Because my background's in food service, distribution, and hospitality, but the most recent position I did a little bit of receivables and payables. So I was just trying to think, what kind of skills, what would be the necessity if I was to,
So the challenges with medical billing and coding, there's a lot of, you're fighting against a lot of people.
Okay.
There's a lot of people in it. And medical billing and coding, I can tell you, you've worked in that industry, I know it, and tomorrow I don't. Like, it changes day to day. Insurance companies, what happens on Capitol Hill, it changes day to day. I would probably volunteer, see if there's an opportunity where you can get some education. There's Epic, which is an EHR, electronic health record company. They want people certified in their tool and resources. If you can say, highlight Epic certification. I don't know in detail, and there's a lot of EHRs out there, electronic health records. Find out what the big ones are. Cerner, if you're in this area, I think it's Cerner, I don't know which way it went, but the VA and the DOD have now merged and are going to use the same software platform. So if you're government contracting and you know Cerner,
What's ready with these?
CRNER. Either went to Cerner or they went away from Cerner, don't quote me on that, but the DOD and VA are going to be on the same system. So they're going to need people that know both. Or no, both departments are going to need someone that knows that piece of software. Electronic health records, you'll see a list of the top 4 or 5 items. Any other questions?
Dive deeper,
Sorry, last question, go ahead.
dive just a little deeper into Ken's question. Compliance, risk, quality management, transferring from one industry, trying to go into healthcare, where? And should the individual, I'm very good with obstacles, great business acumen, great experience and skill set. However, when I see that little bullet that says you must have worked in hospital for 3 to 5 years, the alarm goes off.
So, a neighbor of mine, a nurse, it was actually her mom was a nurse, and she moved, and her mom was still around. I was like, what are you doing? She's like, well, I picked up a traveling nurse position as a case manager, because the demand was so high that they're paying for a hotel for 6 months. The demand in healthcare is so strong that they will, obviously if you're, cutting someone open, they're gonna be able to. But in your case, what I would do is, like we've mentioned, get a gig, get an opportunity, volunteer, go to, I know, where are you, in Maryland, DC? Maryland. Go to the Kaiser and the other hospital systems in your area. Let them know that you're there. Network with them. If they have a meeting, learning more about coding or something along those lines in the area, they're going to do stuff because they're trying to find different ways to find people.
Okay.
They can't wait for LinkedIn to move people. The challenge is as healthcare has grown and grown and grown, retail and all these other places where people did the same thing as you have kind of gone away. They're all looking at healthcare because that's where all the jobs are. So you're going to be competing against a lot of people. If there's 20 bullets on that list and you know 19 of them, and the one is that you don't have 3 years of experience, but you say, yeah, but I got certified in that.
Bingo. Okay, so I'm on the right track. Thank you.
Healthcare is growing, everything. Gig economy is growing, healthcare is growing. Everything else kind of.
Right.
Thanks,
Thank you so much. Before we let you go, please share your feedback with us. It's very important. We want and we listen. We try to bring in speakers and address topics that you